that is Dr. Akwi Asombang. A brief introduction about Dr. Akwi. Akwi is an interventional gastroenterologist at Masjid General Hospital, global health expert with a focus on gastroenterology. She is an assistant professor of assistant professor of medicine at Harvard University, clinical educator and co-founder of Pan-African Organization for Health, Education and Research. POHA is a non-governmental organization with a focus on soundness of health sectors as the cornerstone of social and economic development of all African countries. As a clinical educator, Dr. Akwi's primary focus is clinical care as well as educating and mentoring gastroenterology fellows, residents, and medical students. Some of her achievements in gastroenterology global health include being the co-founder of the endoscopic retrograde cholangiopancreatography program in Haifa, Nigeria, organizing and moderating multiple educational webinars, collaborating and leading various gastroenterology cancer research, presenting at international scientific meetings. Dr. Akwi is a mentor and a gastroenterology consultant. She has registered future gastroenterologists in Africa group for medical students and doctors interested in pursuing gastroenterology training. Some of Dr. Akwi's long-term goals are to develop and strengthen gastroenterology program in Africa through partnership. She also looks forward to expanding the POHA network and unifying healthcare professionals across Africa. Today, in this discussion, our dear mentor, Dr. Akwi Asombang, will lead us into knowing the challenges in medical school and remaining focused in medical school. So, at this juncture, I would like to welcome you, our dear mentor, Dr. Akwi Asombang, to give your presentation to our dear students. Thank you.
Can you hear me? Can you hear me?
Yes, I can hear you.
Okay, all right, perfect. So thank you very much for the invitation, and I look forward to interacting with you. So the way I have this planned, it's mainly to be able to answer your questions. I'm just trying to find a better area with lighting. To be able to answer your questions, I think is going to be the key part for our conversation today. But even before we do that, I think I'll just start off by highlighting maybe just a few points. So the first point is about mentorship. So I think one of the first things is understanding what mentorship means, because mentorship means, you know, something different to different people. So whenever we think of mentorship, mentorship can broadly be thought of as formal mentorship and informal mentorship.
Just a moment,
so,
enter. Just a moment. We
okay.
have a little bit of problem. We want to fix it. Just 1 minute.
Okay, no problem. No problem.
Can you try that?
Sure. Can you hear me now?
Yeah, I can hear.
Okay. All right. Wonderful. So I'm not sure where you left off, but I'm happy to start from the beginning. So first of all, thank you for the invitation. And the format that I have for us today, it's going to be mainly a Q&A. So I'll take questions from the audience, but I'll just go ahead. I think I have about 15 minutes. I'll just go ahead and highlight a few points. So about mentorship, but even before mentorship, one thing I always tell people, medical students specifically, your priority is medical school. There's so many things we want to do, but it's going to be challenging to do those things if we don't pass medical school. So above all these things you're thinking of doing, all these things you're planning, the most important thing is passing medical school. All those things will be there for you to do once you're done with medical school. So now let's go back to mentorship. So when we think of mentorship, broadly speaking, there's formal and informal mentorship. So formal mentorship are programs, sort of structured programs of mentorship. So for example, Poor Hair is more of a formal mentorship program, wherein you have someone who's paired with a mentor. So a mentee gets paired with a mentor, and a mentor is supposed to be someone who has more knowledge, more experience, and provides you guidance, whether it's personal guidance or professional guidance in your journey. Informal mentorship is not necessarily formal, meaning it's not someone getting paired with someone, but it could be a relationship that gets built over time. So you're working with someone over years, you always go to them for advice, for input. They're doing what you want to do. That could be more of informal mentorship. So when it comes to formal mentorship programs, sometimes the mentee and mentor may not click, meaning they may not get along. They were paired together based on what was written down on a piece of paper. But once they meet, they may not necessarily get along, and that's okay. They may not have similar interests, and that's okay. Some of these formal mentorship programs are actually set up in training, whether it's in residency, in fellowship, or even in med school. As you're moving along your journey, you will not always click with whoever is assigned to you as a mentor, because having a mentorship relationship also has to do with just the basic human relationship. How do you communicate with this person? How do you speak with this person? Do you get along with this person? Do you have the same values? So not everyone who's assigned to you as a mentor may be a true mentor. You may never get along, and that's okay because you have a lot of options. Then the next thing, and it's important to differentiate a mentor from a sponsor. Sometimes you may hear about sponsors. So sponsors are generally individuals who you may not necessarily have a connection or close contact with, but they're in a position where they could promote you. So they don't know you, but they may know of you, or someone mentions you, and then they can promote you. They may bring your name as someone who can present at a certain conference. And I think overall, when it comes to mentorship, I have mentors myself. One of my mentors I've known for over 20 years, and I look at her as my personal, professional career mentor. She's someone I always joke around. If I was to get in jail, which I'm not getting arrested, but I use that as a joke, that would be the one call. Like, if you had to call your mentor, who are you going to call? That would be my mentor I can call. She's the type of person where any aspect of my career, making decisions, I can reach out to her. I could text her and say, hey, this is what's going on. I could pick up the phone, and I know that she will give me sound advice. She'll give me honest advice. Because one of the things you want in your relationship with your mentor is you want to be able to communicate honestly. You want to tell your mentor things, and you want your mentor to give you that honest opinion. You don't want a relationship where things are sugar-coated, where things are made to sound good just so that you feel better. That won't help you advance. So it's extremely important when you have that connection with your mentor that it's someone who, you can text, I feel down, I'm having this challenge. I need a lawyer. I need to make this career decision. I just failed on this exam. What do I do? So when you build that relationship with your mentor, you want to have that communication. And like I said, it's not always, it's not always flowers. It's not always a great relationship, but those are people that you need to break away from. So then the other thing I want to touch base, and I can take questions about mentorship in just a short period of time. I wanted to try and highlight a few, some of these points. Then the other thing I want to talk about is networking. So when we think of networking, you need to network with a purpose, right? Meaning, you're not just you don't just like randomly show up to things, but in your mind, you have to know, why are you showing up to this event? What is the purpose of showing up to this event? What are you planning to gain, or what are you hoping to gain from this event? Even if you think of just the one thing that you want from an event. So as a gastroenterologist, I'm more likely to attend, gastroenterology related things. As a mentor with a mentorship program, I'm more likely to attend mentorship related things. I'm not an engineer, so I'm less likely to attend events hosted by engineers. But if I have a purpose, a question that I want, or a program I'm trying to develop, and I will need engineers, then yes, I'll attend the engineering networking session, but with that question in mind. You know, your time is precious, so you don't want to waste your time just randomly showing up to things without a purpose, right? So one of the things you have to ask, what's your purpose? What's the point of this networking? So it's basically trying to network with a purpose, as opposed to just showing up and wasting your time. Then the other point along the lines of mentorship is about, you know, social media, right? So, you know, there's so many, there's LinkedIn, there's Facebook, there's Twitter, Instagram, I don't know, Snapchat, whatever, all these different social media options. So when you're on social media, there's the good and the bad. You know, for some people, social media could be relaxing, but for other people, it could be stress. If it's something stressful, then shut it off. There's no need for you to be on social media. But if you're on social media, you also have to ask, what's your purpose? Why are you on social media? What do you want to gain from social media? It's also important to understand that the different social media networks have different ways you can share a message, right? So you've got, you know, Facebook, which maybe is a little bit more relaxed. You've got LinkedIn, which is more professional. Twitter, it's more like what's happening right now. Instagram, I think it's more of the pictures. So you can select which social media you want, but then make sure you have your profile, right? So if you're on LinkedIn, what's your purpose on being on LinkedIn? Why are you on LinkedIn? Are you there to try and get a job? Are you there to share? I'm on all these different social, on these different social media platforms. And my purpose is to try and share as much as I can about global health, gastroenterology, mentorship. So all these things that I'm doing that could help advance those programs are things that I like to share. You know, I don't use them to, start randomly sharing about, my family or things of that sort. But it all depends on what your purpose is. And it all depends, which social media account you want to use. So, if you want to share about your family, that's fine, but you wouldn't be doing it on LinkedIn because the purpose of LinkedIn is slightly different. If you're sharing about your family, how do you connect it so that it's more meaningful to LinkedIn? And then the other thing you have to be careful about with social media is, sometimes people may share about patients, but you have to remember patients are reading that information, right? So when you're sharing about an experience, if you're going to share about a clinical experience you've had, what details are you sharing? Because someone could be reading and they could identify themselves from whatever you're sharing. And all of this is connected to the mentorship. It's all connected to the networking. I think nowadays with social media, sometimes they look at your social media platforms, maybe to decide to hire you or not, So, and also if you find that social media is stressful for you during the times of an exam, that's not the time for you to be looking at social media. And you have to remember social media life is not always a reflection of real life, right? How many people do you know are posting all the sad, the bad things that are happening? You rarely see that on social media. So sometimes when you're seeing all these things on social media, you might be thinking, oh my gosh, this person's life is great. But you don't know the struggles that they've gone through to reach that stage, right? So that's why it's important when you see these things on social media, don't internalize it and make it you and start comparing, well, this person is there, why am I not there? So when you're using social media, networking, what's the purpose? That's your question. Why are you doing this? What do you hope to gain out of this, right? Ask yourself those questions. And I'll just wrap up by saying, above all, med school is a priority. One thing I always tell, and I'll stop talking here. One thing I always tell my mentees and just people in general, it's about rejection, self-rejection. I always say, don't self-reject, right? Meaning if there's an opportunity, you're on LinkedIn, Facebook, whatever, you see an opportunity, you're like, oh man, I want to apply for this. Apply for it, right? Don't, read the criteria and just make sure you're within that criteria, but don't be the one to say, I am not going to get accepted, so I am not going to apply for this. That's what I mean when I say don't self-reject. And then the other thing I say is be intentional with your time, right? Or just be intentional in general. You have a vacation, make the most of it. If you decide you're going to stay home for your vacation, that's fine. Because if you lose your time, you're not going to regain that time. So be intentional with your time, have a purpose. And I'm going to stop there given the times and stuff. And I'm happy to address any questions you may have. And once again, thank you so much. I think this is a great initiative by the Sudanese Medical Students Association. I think you guys are doing a fantastic job, and I look forward to working with you again on future activities. So strong work to the entire team for putting this together. It's a lot of work to get all these speakers together, so strong work. I'll pause there for now. I could keep going, but I'll pause because of time. Thank you.
Thank you so much, our dear mentor, Dr. Akwi, for that wonderful presentation. I personally have benefited a lot from your presentation. There's quite a lot of things that I was able to understand from your presentation. One, you mentioned about being intentional with our time. You also did mention about prioritizing mentorship, which is something that is really very important for us, the medical student. As we go on with our medical journey and career, there are really a lot of things that we normally encounter as medical students. So mentorship, like you have said, is something that is really very important for all of us, the medical students. So I really thank you so much for that presentation. Before we could move to the next program, I would like to ask you this one question, because as medical students, we often face challenges. We have the interest to gain mentorship, to benefit from mentorship. But there's one thing that is lacking with most of us, and I believe you will be able to help us answer it. So my question to you is that what are some of the ways a medical student can make good choice of mentors? You did talk about making good choice of mentors, because not all mentors are the same. So how, as a medical student, how can I know that this mentor is good for me? Thank you.
That's such a great question. And the reason I think it's such a great question, and I think the whole aspect of mentorship is great, is, let me give you an example. So when you read some of the data in Africa about certain diseases, you might see, oh, there's a lack of data on this, there's lack of this. And sometimes you wonder, why do we have this lack of data, right? Is it because we don't have enough researchers? Is it because the disease does not exist? I doubt it's because of disease that does not exist. I think it's more the lack of people being able to provide that research. I'll use cancer as an example. So there was this, one of these countries, I think it was Kenya, Uganda, where they had shown an increase in a certain GI cancer. And when you look at that data carefully, what you see is it's not that the number of the cancers has increased. Okay, hear this. It's not that the number of the cancers has increased. You can put any other thing. We're talking about diarrhea. It's not that the number of diarrhea patients has increased, okay? But it wasn't the number of cancers. What changed was your ability to make a diagnosis. If you don't have an ability to make a diagnosis, how can you say that it's increased? All right, so where does mentorship fall into place? So some of the programs right now, we're focused on our mid-career, early career, people who are finished with med school. But if we don't invest in medical students, if we're not mentoring medical students early, so then they can identify, if we're not exposing them. So mentorship also comes from exposure. Like my global health related work, some of the people I consider mentors is because I've been traveling with them to all these different countries. We work together and setting up programs. And over time, I didn't have a formal mentorship program with them. But because I've been interacting with them, I've been following them, we've been working together, I now look at them as mentors. When I have a research idea, I'll throw it their way. When they have a research idea, they'll think of me, right? So as medical students, what can you do? You can engage in some of these societies, right? So you've got Poor Hair. You can follow Poor Hair on social media, see what it is we're doing, right? And you can follow what people are doing. You can follow me if you're interested in GI and see what it is that I'm doing. Sometimes you can send an email, or you can, send a message to someone and seeing if they can work with you. And or another organization, because Alafi, and you can attest to this, is the AOTIC, which is the largest cancer organization in the African continent. It is the largest, right? And Alafi can attest to this. So we've had some Poor Hair people who have, had abstracts accepted to this. And Alafi then became, we supported him to be a member last year, and he enjoyed it, that he's continued with that membership this year, right? Now, what he has done, because I see we share and he sees and he posts about these things, is he's attended some of those meetings that AOTIC has provided. They may not be directed at medical students. They may be directed at early career doctors, but he's benefiting from those. So he has been proactive. So as a medical student, you're seeing all these different platforms. You can see, Poher is having this free session, I'll join. NCI, NIH is having the session, I'll join. AOTech is having the session. Because when they share, they're not saying medical students are not allowed. So part of the process is you as a medical student taking their initiative. So if you're not involved in any formal program, but then you can attend these conferences. As a medical student, you have a voice. We had, and I'll wrap this up, I'll give another example. We had a meeting, the African Hepatopancreatic Cancer Consortium. We had it in Egypt. And we had a Poher alum, Dr. Tazikenga, attend, and we had a Lafi as well attend. And they both, in that meeting, both of them asked questions, right? They asked questions from a medical student perspective, from an early career doctor perspective, because the things that yes, I've been to med school. It was 20 plus years ago. My experiences are different from what students experience now. But students can attend these conferences, ask these questions that will make the audience look at you and recognize you and acknowledge, all right, we need to focus on medical students. And number two, we need to focus on this person. Who is this person? Who is this Alafi, right? And so I'm using Alafi as an example because I've seen what he has done. He's identified all these different programs and he joins and he shares. So it's not necessarily someone spoon feeding you saying, hey, I'm your mentor, but he has taken that initiative. He's followed these programs. He gains from these programs, and then he brings and he shares with others. So when trying to identify someone, it all sometimes, those informal mentorship relationships just start from these interactions. You happen to be in the same webinars as this person. You happen to be on the same social media platforms as this person. Then you can easily just send them a message. Hey, I saw your talk. I thought it was great. When are you doing this? Hey, so it starts from there. So there are different ways. Either you can join a formal program, or you can go down this informal and join some of these societies within the African continent. Even start within your own country. You've already started as medical students with this organization, which is brilliant. What you're doing is brilliant, right? And so through this, when you're bringing all these speakers, we're here as your mentors. Shoot us a question. We're here mentoring you guys, providing guidance for personal and professional, because it's not only about professional growth. You need to grow personally. Mind, body, and soul is what they say. So it's not only about reading the books, right? You can read all you want to, but if mentally and physically you're not so well, whatever you read is going to go in and come right out, right? So you need to be strong for your patients. So mentorship is not only just a professional, read your Ganon, read your Harrison's textbook. I mean, if you guys are reading textbooks now, but it also has to do with personal growth, and attending some of these professional career development sessions are very helpful. So it's also being proactive. Hopefully that answers your question, Alafi. And didn't mean to put you on the spot, but I think what you're doing is very well, is a great example of proactiveness.